So one of the conditions that I'd like to speak about today is actually a type of heel pain that many people have. It involves heel pain in the back of the heel. Probably the most common condition of heel pain is on the bottom of the heel, being either plantar fasciitis or heel spur, which occurs on the bottom of the heel. Many people, however, come to me with heel pain in the back of the heel. The back of the heel is where the Achilles tendon, which I'll kind of represent that as the pen, connects into the middle surface of the heel bone, basically in the back of the heel. Oftentimes, where that connection is forms a spur. The Achilles tendon is pulling on the back of the bone, and for some reason, usually it's just chronic wear and tear at the connection, the bone forms a spur. There becomes a little bit of bleeding back there, inside, into the tendon, and then that forms a spur. Over time, those spurs can break. Once they break, they generally become painful, and it's difficult to resolve the pain. We do try many treatments to resolve it without surgery, such as having an orthotic, a heel lift, some sort of a shoe gear change, maybe even some pre-made orthotics or pre-made lifts. There's various treatments, including physical therapy, stretching, medications, and so forth. Many treatments are available, and we try to use as many as we feel that the patient wants to try. Once that we feel that the treatments that are non-surgical are not working, then we can offer the patient a surgical treatment option. The surgical treatment option involves looking at the back of the heel, making a cut to open the back of the heel right over the Achilles tendon. The Achilles tendon connects right in the central part of this bone, which we call the central 1/3. Central 1/3 is pretty much in the middle. To diagnose the condition very easily, if you just push on the central 1/3, it's usually very, very tender right at that spot. It's usually not so tender on the sides, but it's sort of right in the middle where it's tender. So we make this incision, and pretty much we go right down to the Achilles tendon. The most common way to perform the surgery is to open the Achilles tendon, because the bone spur is below the level of the Achilles tendon as we're looking at it. Patients are usually laying on their stomach. So I have a very good visual field. I can see the Achilles very well. Achilles would be going up in this direction, and the connection is right here. So we pretty much focus on the connection. I usually make an incision directly through the Achilles, pretty much make equal sides or equal halves to the Achilles. We just split it right down the middle, and then I make an incision going across here, which is pretty much like an upside down T type pattern through the Achilles. Then we're able to flap open the Achilles, open it, and then right below that we see the spur. I'll usually take off the spur with some sort of a nipper, or maybe even a small power saw to grind off the spur. We usually smooth it all down, make sure it's a nice flat surface. Then what we need to do is we need to repair and reattach the Achilles tendon into the bone. That's done through an anchoring system, which is a very excellent anchoring system used in orthopedics. They use a similar system in orthopedic shoulder surgery when they're doing repairs there. So into the Achilles, for the Achilles repair at this point, we're using 4 separate anchors in a box-like pattern, and we're placing the anchors directly into the bone. The anchors stay in the bone for approximately 2 years, at which time they, over time, dissolve into the bone, and the new bone then just creeps into where the anchors were and lays down new bone, forms new bone. At approximately 2 years, the anchors are supposed to be completely gone, and you don't see them. What comes out of the anchors is a suture material, or a type of stitch that's a permanent stitch. Those stitches go through the Achilles, and that's what we can use to basically tie down the Achilles back down to the bone. One of the nice features of this system is there's no knots on the back of the bone. There's not much skin or tissue on the back of the heel, so you really want to avoid putting a lot of prominent suture material in the form of knots back there. So this is a knotless system that anchors the tendon right down into the bone. Then we close it up, put on a dressing, and usually some sort of a splint or cast. Patients heal over several weeks. While they're healing, we keep the patients off the foot so that the Achilles can heal down to the bone. What I usually tell my patients is that the Achilles is the largest and strongest tendon in the bone. It is greatly involved in walking and even driving. Think of pushing on the gas. When you're doing that, basically you're using your Achilles tendon. So while this is healing, it needs to have rest. It needs to be immobilized to allow this to heal properly. We certainly don't want to go through all this and then have people walk on it too soon and damage the surgery. Once it's healed, we gradually progress them back into walking and back into their shoes. Sometimes they need physical therapy, sometimes they can just do it on their own. The surgeries are typically very effective, and patients are typically very happy once they have the surgery done and they're all healed up. If you would like to find out more about this surgery or other foot or ankle surgeries, feel free to give us a call at the number below.